You have hardware inside of your body somewhere. Should you get it taken out?
You mean like something I bought at Home Depot that's not supposed to be in there, like a roofing nail, a staple gun?
So yes, you should get that out, but no, that's not what we're talking about today. We're talking about surgical hardware, typically for fixing a fracture.
Plates,
Screws, rods, pins. Wow, it's like we're stepbrothers there.
All right, good question.
Okay.
And we have a few criteria that we use that help us determine if we should surgically remove that surgical hardware that was surgically implanted.
Okay, so what's the short answer? Someone says, Doc, I got this hardware, should I get it taken out? What's your answer?
Probably not.
Okay, why?
Most likely not, because usually it's benign and fine, and it's not really causing a problem.
You mean like it's inert?
Yeah.
Like doesn't cause a local reaction or anything?
Yeah. And then to take it out is a surgical procedure, which carries with it risks.
Right.
We always look at risk-benefit ratio, and if the benefit is very small, then the risk-benefit ratio favors risk, so don't do it.
Okay, so the first take home is, generally speaking, if you have hardware and it's not bugging you, leave it in. It's not going to cause any problems. Leave a comment if you have any hardware in your body. Let us know where it is, how it got there, what happened, how you slipped and fell off the ladder.
That's being very presumptuous.
Yes, okay. So what settings, we have 6 primarily, that require or are more likely for you to require having your hardware removed? Let's start at the top.
It's bothering you. You're
Okay.
having pain or it's irritating. It's in a very superficial place. Like, for example, on your ankle, you love to ski. It irritates when you put the ski boot on, or at least that's what you're blaming your poor skiing on.
Right.
And so that's a reason that you can take it out. It's giving you pain, it's irritating, you can feel it, that kind of thing.
And this is common, particularly in bones that don't have a lot of meat or soft tissue on top of them. So the tip of the elbow, the front of the knee, the ankle. Clavicle, yeah, that kind of stuff. Number 2 for me is you can see the hardware. So you can see metal that has actually broken through the skin, almost like eroded through the skin.
Yeah. Then it's got to come out.
It's got to come out.
And because that ties in with my next one is it's infected.
Okay.
Hey doc, does this look infected? Yes, it looks infected.
Okay,
it's
Sum
sticking under the
41
skin.
album.
Throwback. So
Throwback.
yeah, if there's an infection, you have to get rid of the infection.
Why? Why do you have to take it out?
Because bacteria love to stick on foreign materials.
Okay.
Okay. I always tell people, if you have a splinter and it's getting infected, you can take all the antibiotics you want. You're not going to cure yourself of that infection until you remove the splinter.
Yep.
When I was a kid, I got one under my nail once. Oh, tough place to get a splinter.
People torture.
It scarred me, not physically, but mentally. So if it's infected, it's got to come out. Sometimes you may have it in place and it's infected, but we're waiting for a bone to heal, and we might wait a bit and give you antibiotics to suppress it until the bone heals, and then take the hardware out.
Okay.
And that's getting a little bit fancy here. But yeah, generally, if it's infected, it's got to come out.
Okay, number 4 for me is preoperatively. So sometimes when we replace people's knees, they have hardware like either in their femur or in their patella or in their tibia that's kind of in the way of the operation that we're going to do. So sometimes you have to remove the hardware either at the same time or potentially as a staged operation to facilitate a more definitive procedure like a joint replacement.
Okay, so step 1 of a 2-step treatment.
There you go.
My next one is it failed. Fail. So it's supposed to do something.
So you mean like the surgeon didn't put it in right?
No, maybe, possibly.
But probably not.
Possibly, but not necessarily. Yes. Sometimes, all treatments work have a certain percentage of success associated with them. That means they have a certain percentage of not success associated with them.
So when we use hardware to fix a broken bone, like why would it break?
Okay, so hardware is used to fix a broken bone. It's not really fixing it. It's holding it together until the body heals that broken bone. Because the hardware will fail if the bone doesn't heal, because it'll fatigue. Like when you take a paper clip and you bend it, and then it breaks.
I
right?
think I get the point.
Same thing with the hardware in your leg. When you walk, you're bending it, and it will break unless the bone, which is a living structure, heals, and then the hardware's not doing anything.
So if your bone doesn't heal, it for sure is going to break eventually.
Eventually, the hardware will break. Okay, so that is a reason to take it out, because it didn't do its job, and you might have to put new hardware in to make the thing heal that you were trying to get to heal in the first place. Or it might not even break, it might just loosen.
Right.
And then, again, it won't be doing its job.
Okay. The last one for me is if the hardware has entered the joint surface. So even if you have a fracture around a joint, we put the hardware in such a way that it is not breaching or penetrating or going through the articular cartilage that makes up your joint, because that will lead to arthritis. So if there is a screw that somehow, or a plate that somehow ended up in the joint itself, it has to be removed, because your cartilage is very unforgiving. And if there is damage to the cartilage, that will lead to arthritis. So we have to remove it. That is not negotiable.
Right. unless it was an implant designed to be in a joint, like a total hip or a total knee.
Right.
We don't call that hardware though. We call that implants.
Yeah. We don't really put it in the cartilage.
No, that's true.
Yeah.
We replace the cartilage.
We replace the cartilage.
Okay, so
Now you know. So there's a bunch of reasons where you have to have it done, but most often I'd say the lion's share of times we just leave it in because it doesn't bug you.
yeah, don't poke a sleeping lion. Because if you do have another surgical procedure to take out that hardware and you didn't need to have it done, you might have complications associated with that. Right. And you didn't help anybody.
If you do have to have it taken out, because it is prominent, is there an amount of time that you specifically like? Is there a minimum amount of time? Like 2 months later, can you take it out?
Well, it depends on what it went in for, but
Yeah.
for fractures, we usually say 1 to 2 years before you take it out.
Let that bone get nice and solid. Now you know all what to do with your hardware. If you like this video, please like it, subscribe to our channel.
Leave a comment, and remember, you are in charge of your own health.
See you next time.